HIV and hepatitis B have interesting similarities that can be used to understand the two diseases better. Both are infectious diseases that affect the human body, albeit through different mechanisms and with distinct consequences. You are watching Zoom Hospital Channel, and I am Dr. Kayode. For clear understanding, we will be comparing HIV and hepatitis B under the following. 1. Cause. HIV is caused by human immunodeficiency virus, which is a retrovirus that attacks the body's immune system. Whereas hepatitis B is caused by the hepatitis B virus, which is a different type of virus entirely. Hepatitis B is the most common serious liver infection in the world. 2. How long someone can spread the virus. People with HIV who take HIV medicine as prescribed and get and keep an undetectable viral load, a very low level of HIV in the blood, can live long and healthy lives and will not transmit HIV to their HIV-negative partners through sex. Interestingly, those with chronic hepatitis B can remain infectious for many years. Even if test result says viral load is undetectable, it does not usually indicate that they cannot transmit the virus until further evaluation is done. A man with an undetectable viral load, for example, can still spread infection as his semen will contain hepatitis B virus. 3. How it spreads. HIV is primarily spread through sexual contact, sharing needles or syringes, and transmission from mother to child during childbirth or breastfeeding. HPV, on the other hand, is primarily spread through contact with infected blood or other body fluids, such as semen and vaginal fluids. Note that hepatitis B is more infectious than HIV, but have similar means of transmission like HIV. Hepatitis B is easier to catch than HIV because it can be 100 times more concentrated in an infected person's blood. 4. Approved treatments. Antiretroviral therapy is the standard treatment for HIV infection. There is no cure for HIV, but with proper treatment, people with HIV can live long and healthy lives. Gene therapy and editing clinical trial is currently going on to cure HIV. Treatment for hepatitis B infection, on the other hand, may include antiviral medications to suppress the virus, regular monitoring of liver function, and vaccination for close contacts of infected individuals. However, treatment may not cure the infection in most cases, particularly in those with chronic hepatitis B. There are many cure attempts in clinical trials with significant level of success. 5. Vaccine. There is currently no vaccine available for HIV, but there are ongoing clinical trials on HIV vaccine. But for hepatitis B, there are safe and effective vaccines to prevent hepatitis B infection. The hepatitis B vaccine is typically administered in a series of shots. 6. Complications. Complications of HIV infection include opportunistic infections, AIDS-related cancers, neurological disorders, and cardiovascular disease. Whereas complications of hepatitis B infection may include chronic liver inflammation, chronic hepatitis, cirrhosis, liver failure, and liver cancer. 7. Affected body part. HIV affects the immune system, leading to a progressive weakening of the body's ability to fight off infections and diseases. But hepatitis B primarily affects the liver, causing inflammation and potentially leading to liver damage, cirrhosis, or liver cancer. 8. Signs and symptoms. Early HIV infection may present with flu-like symptoms, including fever, fatigue, sore throat, and swollen lymph nodes. As the disease progresses, individuals may experience more severe symptoms, such as opportunistic infections and weight loss. Symptoms of acute hepatitis B infection may include fatigue, nausea, abdominal pain, jaundice, yellowing of the skin and eyes, and dark urine. However, many individuals with hepatitis B may not experience any symptoms, can later progress to liver cirrhosis and liver cancer and liver failure, which will make the patient to have leg swelling, abdominal swelling, and weight loss. 9. Incubation period. Symptoms of acute HIV infection may appear within 2 to 4 weeks after exposure, but it can take years for symptoms of advanced HIV infection to develop. Symptoms of acute hepatitis B infection typically appear within 1 to 6 months after exposure, but symptoms of liver failure takes years to appear. 10. People at higher risk. Those with higher risk of having HIV include gay, bisexual, and other men who have sex with men, people who have unprotected sex, or needle-sharing drug users, infants born to HIV-positive mothers. Hepatitis B have similar risk profile. However, those with underlying liver conditions are more at risk of chronic disease. 11. Method of protection. Prevention measures for HIV include practicing safe sex by using condoms, avoiding needle sharing, and taking pre-exposure prophylaxis for high-risk individuals. Additionally, early diagnosis and treatment of HIV can reduce the risk of transmission. Using precautions to prevent mother-to-child transmission during childbirth. Prevention measures for hepatitis B is also similar to that of HIV, except for vaccination. Note that all household members of affected individuals should be vaccinated. Kindly subscribe to our channel and hit the notification bell so that you can be notified anytime we release a new video with a life-saving medical innovation. You can contact us via the link in the description below for any medical inquiry.